Well, welcome back. It's time for your health segment. And of course, tonight we are focusing on the ongoing discussion whether it is possible for us to end polio once and for all. And for more insights, now joining me in studio, of course, we have with us Ahmed Arale, who is the director at the Core Group Polio Project at the Horn of Africa Secretariat. Thank you for joining us this evening.
Thank you so much, Catherine, for having me in the studio tonight.
Indeed. Let's begin. We always like to begin with the numbers. Yeah. What do the statistics look like when we are talking about the problem of polio globally and, of course, in our country?
I'll take you back. When this effort of polio eradication started, the Polio Eradication Initiative in 1988, approximately 350,000 persons were paralyzed in that year alone.
In 1 year? In
1 year, and that's 1988. In comparison, last year, 2018, we only had 33 persons paralyzed. And those ones were from just 2 countries.
2 countries.
Yes.
And we are talking about Africa?
No, that is globally now, the global picture. Because in the same 1988, we had 125 countries that were regarded as polio endemic. That means wild polio virus was freely moving in their countries. However, in 2018, we only had 3 countries that were polio endemic. That was Pakistan, Afghanistan, and Nigeria. And the good news for Africa, because polio certification is done regionally, not country-wise. So if a country in Africa is still having polio, you cannot be certified. So the good news is that August this year, Nigeria is 3 years free of wild polio virus. So there's hope. Yeah.
So have we kicked polio out of Africa based on what you're saying? If Nigeria was the only country, in Africa, and now it has been declared to be.
It is too early. It's just that this August 2019 is when we got the good news that Nigeria is 3 years free of wild polio virus. However, the global certification committee will have to give some time and then check. And then that's why when we can get the good news that Africa is polio-free.
Okay.
Yes.
We've been talking about this campaign for a long time. Why is it that today we are still seated here talking about, now ending polio for good?
That is a very good question. The reason why we're still grappling with is that there are still countries. As I told you, we already have 2 countries that are endemic, Pakistan and Afghanistan. So as a global world, as a global village, when we have a virus somewhere, if one child is infected with the virus in any country, all the other children in other countries are at risk. So if you have one in Afghanistan, still we are under risk.
So what is the major contributor perhaps in your analysis that is causing Pakistan and Afghanistan not to be able to fight this?
Yeah, there are various reasons. One of them were conflicts, countries with conflicts. Some with cultural, religious, and political differences. So many times, if you look at the polio virus, it tends to be in areas with conflicts, whereby children don't get the opportunity to be vaccinated. So, and that's why you could see the pattern in Nigeria. Problem was northern Nigeria, where mostly we have Boko Haram, whereby they will not allow polio vaccination. The same case with Taliban in Afghanistan and Pakistan. So the children who are supposed to get the vaccination did not get. So, and that's why we are afraid that that virus can still go to an area with children who have low immunity. Yes.
All right. So what interventions perhaps are you putting in place to ensure that you try and contain this?
Polio eradication has 4 key pillars. And one of them is every country is supposed to have a robust surveillance system to detect any acute falcid paralysis, and it has to be investigated. The second one is mass vaccinations.
Yes.
We have to ensure that we stop the virus from spreading. And doing that is you have to have regular mass vaccination. That's why you see campaigns coming after one after the other. The other one is mop-up campaigns, where we believe that there's high risk. We do mop-up campaigns. Like currently in Kenya, you hear of 11 high-risk counties.
Which counties are these? Perhaps you can mention the
Nairobi
top 5.
Nairobi is one of them, because Nairobi is a transit hub.
Yes.
Everybody comes, and you'll get immigrants, people who could be not immunized or could be infected. And then we have counties in northern Kenya.
Yes.
Garissa, Wajir, Mandera, Tana River, Marsabit, Turkana. Because of the border areas with these countries. A country like Somalia doesn't have the infrastructure to immunize children.
Yes.
You can fully understand that. So for us, our issue is importation of the virus from Somalia.
Yes.
Last year, we had, from our environmental surveillance, sewage samples are taken to Cambridge to test on routine basis. So last year, we had viruses found in Kamukunji, Isili.
Yes.
And
it was being linked to the sewer system?
Yes, and then from the sewer system. So that genetically was linked to Somalia. So you see the importation that is coming from. So that's why these counties in the north are high risk.
But are people receptive, in terms of immunization? Because we've seen sometimes people beginning to say that this polio campaign, we can't keep doing it all the time. Of course, there are the myths that the vaccine has, is intended to do different things other than fight polio.
Yeah, to a large extent, Kenyans are receptive. Even though we still have pockets where there are challenges. I mentioned northern Kenya. We have a highly vulnerable mobile population, the nomadic pastoralists,
yes,
who transit borders. They cross here and there. They are not served by the conventional healthcare facilities. So many times they have low immunity. They are mobile. They are today in Somalia, tomorrow they cross. So these are the aspects, some of the challenges. Some other aspects include some sects that will want
the religious institutions.
Religious differences and all that. Yes, so the challenges are there. And Horn of Africa is really, in fact, a problem as far as polio eradication is concerned because of Somalia. Currently, in the Somali region of Ethiopia is battling an outbreak. And towards the end of last year, the ministers for Kenya, Somalia, and Ethiopia came together to now declare that as a public health emergency of international concern. And now we have synchronized campaigns. So when we are doing it in the 11 counties of Kenya, we are also doing it in Somalia. And
so the immunization itself?
Yes.
Okay.
The Kenya, Somalia, and Ethiopia should do at the same time so that we stop the transmission of the polio virus.
This brings us again to the question of funding.
Yes.
Is there sufficient funding to keep doing the continuous campaigns?
Yes, that is also
because we've seen campaigns start and sometimes they stop because of funding issues.
Yes, to some extent funding is there, but of late there was what they call polio rundown. Globally, polio has been eradicated. As I told you, we have come from far. Almost like over 90% of countries are now polio free. So funds also get to shrink because now people see the disease is going. So there's that rundown of funds. However, the global community, the Global Polio Eradication Initiative is still always on standby. If there are cases anywhere, funds are availed.
Funds are availed.
Yes.
All right, let's talk about, perhaps just the impact in terms of trying to survey, the surveillance.
Yes.
Do you have enough, tools to be able to do this? Because now, like you just mentioned, the issue about the sewer system, can we be able to do environmental surveillance?
Yes.
What is the capacity like?
The capacity is there. I think our Ministry of Health has the capacity to have these sites in all major centers. Currently, we have even as far as Garissa, where we do this environmental sampling, from the sewage, Mombasa, Nairobi, especially those high-risk areas. The other thing the ministry and partners are doing is community-based surveillance. And especially for us, our project is doing community-based surveillance in all these high-risk northern Arale counties.
What does it entail, the community-based surveillance?
It entails building the capacity of the communities to be on the lookout, because in a community, they know each other. They know who is sick. who has not been vaccinated. So among them, we have the community health volunteers who have been the backbone of surveillance. They are volunteers and they assist in ensuring that they report on weekly basis from all their communities. And really that has been successful. And that will make things sustainable as far as surveillance is concerned once communities' capacities are built, because they will know the disease, they will be sensitized, and they will report. Yes.
So how many times perhaps should someone get immunized against polio? Because people are always complaining that every other time, every 6 months, 1 year, you always need to get a polio vaccination.
One thing that is really critical is that a child has to first finish the routine immunization. There's that routine that once the child starts a clinic, and then they have the first oral polio vaccine, second, third, and then recently we have added an injectable, which is called IPV.
However, it's given at what age?
One of them is given at 4 weeks, 6 weeks, 10 weeks. The IPV is given at 14 weeks. So, and that is within 1 year. However, because of the risk that is currently facing us, we have to do this mass vaccination. And what we know is that the more this oral polio vaccine is given, the more it will boost the immunity of the child. So the number does not matter. I know people say they have been getting this throughout. Every month there's a campaign, next month there's a campaign. And to some extent, people feel like really,
that you're ever exposing the children to vaccines.
However, what we want to emphasize is that let people get credible and factual information from reliable sources like Ministry of Health, World Health Organization, KEMRI. But people, the social media is really a challenge, because there are people who are against some of these vaccines, and because of that platform, it goes wide. And that is not the credible source of information.
Okay. Let's talk a little bit about perhaps the symptoms that in the event that your child gets polio. What are some of the symptoms that a parent should look out for?
Yeah, the parent should look for is, some of the symptoms is fever, headache, lethargy, and then sudden onset of floppiness of the limbs, the upper and the lower.
And the lower?
Yes, and sometimes either upper or lower. And in such cases, the parent is really supposed to report that to the nearest health facility or health worker. Yes.
In terms of money being put towards research to perhaps find a way to reverse the process, what is happening in terms of now research and possible treatment?
What we know is that as much as polio is a crippling and potentially a fatal infectious disease,
yes,
it has no cure, but it has vaccines that are safe to prevent it. So the main issue is prevention.
It's prevention.
Once the damage is done, the paralysis is done, nothing much can be done. The rest is maybe physio that could be done, but the thing is prevention. Yes.
But in terms of research, is there a lot that is going towards, trying to really see if there's a way we can get to a cure at some point?
Yeah, I'm sure the scientists are always on their toes. However, what we know is that for polio, prevention is the thing. Currently, there's no cure. Yes.
Okay, as we move forward, you're talking about ending polio for good.
Yes.
How possible is that?
That is quite possible. And at the end of the tunnel, this light, and from 1988, from all those numbers, currently we are talking, polio has foothold in only 2 countries currently.
The 2 countries that you mentioned?
That is Pakistan and Afghanistan. That has been 0-2. And if we keep up the pace of immunization, high coverage of immunization, of which we are supposed to have above 80%, that will keep the virus out. Yes. Okay,
so going forward, what should we expect to see in terms of your campaigns?
I think because of the outbreaks in Horn of Africa, Ethiopia, the Somali region of Ethiopia, Somalia, we are still at risk as far as Kenya is concerned, because what we had were importations. And what we want to do is to ensure that we don't have any infection here by doing mass vaccinations. And one of the campaign is coming in November. Recently we had one, you know, another one is coming. So it is incumbent upon everybody who knows something about vaccines to tell the truth about vaccination and ensure that kids are vaccinated. Because if one child is infected in somewhere Pakistan, the rest of children in other countries are at risk.
They're at risk. All right. I'm told our time is up, but I'll just give you a minute to look into the camera and perhaps speak to the Kenyan people on why it is important for them to actually get their children vaccinated against polio.
What I wish to say is that we are ending polio. We are at the end game. The legacy of polio eradication is ensuring that no child is infected. And we are onto that. What we argue is to spare the children and vaccinate them. One thing I wish to say is that core group is next month holding its first conference out of United States of America, bringing it to Kenya for the first time, bringing it to Africa and Kenya and Nairobi. It is called Global Health Practitioners Conference.
Yes.
It is leveraging, linking, and learning for community health. I urge you to see you there also in Safari Park from 14 to 16. Thank you.
You're now going to the communities.
Yes.
All right. Thank you very much. We appreciate you coming here this evening and giving us insights on what you're doing. And obviously there is a lot of hope if you're saying it's only 2 countries that are yet to completely fight polio. Well, this is where we put a cap on your health. Of course, I've been talking to the director of Core Group Polio Project in the Horn of Africa Secretariat, that is Ahmed Arale, just putting into perspective some of the interventions that they're currently undertaking to ensure that we end polio for good. Let's put an end to this show, but of course, Business News is up next with Betty Kiptum.